Hi, everybody. I am Kristina Whiton-O'Brien. I am the Shine Program Manager for the Barnstable County Human Services Shine Program. Our region covers all of Barnstable County, which is Cape Cod. We also cover Martha's Vineyard and Nantucket as well. So we have about 80 Shine counselors across Cape Cod and the islands who are available at most of the councils on aging. We do have a couple of community service organizations where we have Shine counselors as well. But all of our Shine counselors are trained and they are there able to talk to folks about signing up for Medicare, problems with Medicare, how Medicare intersects with mass health, and also long-term care options and any issues that folks are having or questions that they have about that. I'm also joined by Kathleen Gouveia. Kathleen, do you want to introduce yourself?
Sure. My name is Kathleen Gouveia, and I'm the Shine Training Coordinator at the Executive Office of Aging and Independence.
Great. So we get some of our money through the state of Massachusetts as well as the federal government. There are Shine programs, I believe, in every single state. So we'll give a lot of that information though at the end, so that if folks are interested in meeting with a Shine counselor locally on Cape Cod or in Massachusetts, we can give that information. And across the country, Shine is also known as SHIP in other areas. We can also provide that information. So we're going to start off just talking very broadly about Medicare, so that folks can kind of understand how Medicare works, the parts of Medicare, and then get into more specifics about long-term care. So Medicare is the federal health insurance program that helps with the costs of Medicare, but it's not comprehensive and there are some gaps. And that means that not all medical expenses are covered for. And as you can see here, the costs of long-term care are typically not covered, but we will talk about different options for that. We have a picture here of what the Medicare card looks like. It's a red, white, and blue card. It has the parts of Medicare and when you signed up, as well as your Medicare number on this. Now, Part A is your hospital insurance. Part A is usually free because many of us have contributed to the premium for Part A by working about 10 years or 40 quarters. So typically we don't have to pay that premium for Part A. Part B is your medical insurance. That covers anything that is mostly outpatient doctor's appointments with primary care doctors, specialists, anything that is done on an outpatient basis with blood work, x-rays, MRIs, all of those kinds of things. Sometimes even medications are covered under this. It's something that might be injected or infused by someone else. So whenever like chemotherapy, if you had to go to the hospital or a center for something like that, that would be covered under Part B. The rest of your drugs that you would pick up at a pharmacy are usually covered under Part D. Part A, B, and D are what's known as original Medicare. There's the most flexibility with original Medicare, and we'll get into that a little bit more. You can typically see any provider that takes Medicare. You don't need to worry about referrals or networks. There is a lot more ability to, see who you need to see as well as pay monthly premiums. Now, the other option for Medicare, and this is all to fill in the gaps because again, Medicare is not totally comprehensive, is Part C, also known as Medicare Advantage. And what that does is it bundles A, B, and D all together, and offers some additional, what I like to call bells and whistles, such as vision, hearing, or dental. This is all managed care by private insurance companies. So we'll get into the details a little bit more, but that's kind of a basic overview of Medicare. And I also want to invite Kathleen to chime in at any point in time if you think there's anything to add as I go through some of these slides. So we talked about kind of the different options for Medicare. So this slide just kind of breaks that down in a better visual. So on the left-hand side, you'll see original Medicare, which is A and B and Part D. You also may have heard of a Medigap or supplemental plan. That comes into play to help pick up some deductibles, some copays, and there are different levels of Medigap. Every state does it very differently. Here in Massachusetts, we have 3 levels levels of supplements, and our supplements are really governed by the Division of Insurance. So we have some more flexibility with our supplemental coverage. We have something called continuous enrollment in supplements in Massachusetts. We also have and no discrimination against pre-existing conditions. The other side is that Medicare Part C, which is the other option. So you have A and B as your foundation, or you can get Original Medicare, which is a Medigap and your drug plan, or you can choose a Medicare Advantage that are HMOs and PPOs. Most of them include a Part D drug plan. And again, they also may include other things like vision, hearing, and dental. These have networks. These also have referrals that are required. So, for example, an HMO, you would need your primary care doctor to give you a referral to a specialist or a referral for a test or procedure. PPO is a preferred provider network or option, and that allows you to go out of network. Usually that is at a higher copay. And the Medicare Advantage plans are some of them have the zero premium, some do have higher premiums. Most of them, all of them have copays. So every time you go to a doctor or you go for a procedure or you go for a visit, there can be a copay. Sometimes if you're in network, it's $0. Sometimes it's $20. Sometimes it's $40. For the PPO plans, if you're looking to go out of network, it could be as high as a 45% coinsurance. So who's eligible for Medicare? Most people, when you turn 65, we get a lot of calls of those folks, and you're a U.S. citizen or lawfully permitted resident for at least 5 years. Those are folks who are eligible. Medicare is also available for certain people with disabilities who are under 65. These folks should have received Social Security disability income for about 2 years, or they could also have end-stage renal disease or ALS. And those folks would be on the SDI for two years and then transition over to Medicare. And as I said earlier, most folks are eligible for premium-free Part A if they've paid their Medicare taxes, which is about 10 years or 40 quarters. For some folks also, they could get it through a spouse or an ex-spouse's work record. And increase in age for full Social Security benefits does not accept eligibility for Medicare at age 65. Now, you could also be working past 65, and we'll talk about that a little bit more. But basically, if you want to enroll, you would enroll through Social Security. You can go to ssa.gov and set up an account, or you could call your local Social Security office and make an appointment and go in person to sign up for Medicare. If you were already collecting your Social Security, you will be signed up for Medicare A and B automatically when you're first eligible. So there are different enrollment periods for Medicare. The initial enrollment period is right around your 65th birthday. That's 3 months before your birthday month, and 3 months after. If you miss that, there's a general enrollment period, which is January 1st to March 31st. And then there can be special enrollment periods. And here at Shine, we can assist you with any questions you might have related to the enrollment period, or if you miss an enrollment period. We can also help you find possibly a special enrollment period if you qualify in certain circumstances. Now, if you already have Medicare and you want to make a change, the good news is, and we advise people not to put your Medicare on autopilot, and you do want to check it to see if you can make a change. There is the yearly open enrollment period, and that's in the fall. So think back to school time. October 15th to December 7th is when you can make a change for the next year. So this year, if you come to open enrollment at a Shine office between October 15th and December 7th and you make a change, it would be effective January 1 of 2026. You can change your Part D drug plan. You can change from Original Medicare over to Medicare Advantage, and you can change from Medicare Advantage to Original Medicare. Medicare Advantage also has its own open enrollment period. So say you have a Medicare Advantage plan and you miss open enrollment from January 1 to March 31st, you can make a change to your Medicare Advantage plan, you can switch to another plan, or you can go back to original Medicare. And say you come into the office on January 15th to do that, your coverage would be effective February 1st. And as I mentioned, there are special enrollment periods that can help you get out of a plan or change your drug plan, depending on the circumstance. And we at Shine can certainly assist with that. Now, I've already talked about the initial enrollment period, the 7 months around your birthday. This is more of a visual to help you understand it. So the middle is the month you turn 65. You have 3 months before and 3 months after. And typically, if you sign up before you turn 65, Medicare would be effective the first of your birthday month. If you sign up the month of your birthday, it would then be effective the month after your birthday, and then the subsequent months are the first of the following month as well. Now, I mentioned earlier about working past 65. A lot of folks are doing that right now. So if you have an employer group health plan, or if your spouse is continuing to work and you're on your spouse's plan, you may be able to delay Part B. You can choose to enroll in Part A because Part A is typically premium free. So a lot of times people like to sign up for Part A just to start the process, but they're going to delay Part B. Part B is usually something you would pay a premium for. So it doesn't make sense for a lot of people to be paying for an employer group health plan and to be paying for Part B. So because most of us have Part A as premium free, many folks sign up for that to act secondary to their employer group health coverage. Now, it's important to know that your employer coverage is as good as Medicare. So you want to, one of the ways we determine that is the number of employees at an organization. So typically, if there are 20 or more employers, your health care should be fine and you can continue on your employer group health plan. If you're under 20 employees, that's when you want to double check with your HR office and confirm whether or not you should be signing up for Part B. Typically, if an employer has 20 or less employees, then that means that somebody would need to be signing up for Medicare when they turn 65. The other thing to make note of are HSA health savings account plans. You may want to delay Part A because you can no longer contribute to an HSA account, and there should be a period of time before when Part A coverage begins. So if this is a circumstance that relates to you, you want to check with your accountant or whoever does your taxes or the IRS about the details of this. But just to kind of use that as a flag that if you do have an HSA account, you need to pay attention to when you sign up for Part A. Um, so after your initial enrollment period, if you delay Part B, when you end your job, you retire, or you leave your position, you have a special enrollment period that is up to 8 months after coverage ends to sign up for Part B. So that's a long period of time, but you also want to pay attention to sometimes organizations will offer COBRA plans. And Kathleen, I want you to double check me here, but COBRA doesn't really work with Medicare. So if you're 65 and you're leaving a job, you should really be signing up for Medicare because COBRA, you can run into some trouble with COBRA. Am I right about that, Kathleen? I see
Yes,
Kathleen
yes, you
nodding.
are.
Okay, good. Good, good, good. Um, so so you really do want to make sure that you're noting when your employer group coverage is going to end so that there are no gaps, and you make sure you're signing up for Medicare as soon as that coverage ends so that there's a really, again, there's no overlap and things are kind of lined up really nicely. Um, you
One
can
other
delay. Oh,
Oh,
go ahead,
sorry,
Kathleen,
one other
please.
thing, if you don't mind me stopping
No?
you there too. So we have the 8 month special enrollment period to enroll in Medicare Part B, but for Medicare Part C or Medicare Part D, there's actually only 2 months or 63 days to enroll in either a Medicare Advantage plan or a Medicare prescription drug plan. So I think that that's important to note. Like knowing all of these dates, there's a lot of dates and rules surrounding enrollment is critical.
Yeah, and we usually advise people to sign up for everything at the same time so that you're not confusing yourself and you're making sure that all the boxes are checked, and that there is no gap because there are penalties, and we'll talk about the penalties, and those are lifetime penalties, so you want to avoid that. And here we are, penalties. So there's a penalty for Part A, late enrollment, but that's only if you are not eligible for a premium-free Part A. So again, most of us are, so this doesn't really apply to the majority of us, but if for any reason you don't get premium-free Part A, you really want to be paying attention to when you're signing up because you don't want to be hit with this penalty. Part B also has a late enrollment penalty, and this is a surcharge that is added to your monthly Part B premium. For 2025, the Part B premium is $185. So this is calculated at 10%, so that's $1,850. So you would add the 1850 to the 185, and that is every month. And again, these penalties are for life. So if the Part B premium goes up next year, that penalty goes up, et cetera. So you just really want to avoid the Part B penalty. Also, Part D for the drug plan, there is a penalty. A lot of people come to us and they say, well, we're not even taking any medication. Why am I signing up for a Part D plan? But it's very important to do that because if you don't, it's a lifetime penalty as well. And this is calculated at 1% of the national base beneficiary premium for each month that you're not enrolled in a Part D drug plan. So that base premium is like around, I'm going to say $35. So 1% of 35 is 35 cents. But again, it's for every month that you don't sign up. So, you do want to be paying attention because that 35 cents can add up, particularly based on the number of months that you're late and the number of years that you pay for it. So, again, just be really cognizant of when you need to sign up. Now, the costs of Medicare, a lot of people that we meet with are surprised to know that Medicare costs something. They think that they've contributed through their taxes when they've worked throughout their life and that there isn't a cost, but there is. And most of the costs are either deductibles or co-pays or co-insurance. So here we have a list of what those deductibles look like, and this is all for what original Medicare is. This is just Part A and Part B, and this would be something you might want to add a supplement to. So the Part A hospital deductible, anytime you go into the hospital, the deductible is 1,676 per beneficiary period. And I think that's about 60 days. So you want to pay attention to this because if you have a chronic illness, if you're accident prone, or if you tend to go to the hospital a lot, these can add up. I worked with someone her husband went into the hospital in January and came home. They got a bill for 1676. He went back in June, came home, he got another bill for 1676. So you really want to pay attention to that cost. And then there's a co-insurance if you're in the hospital longer than 60 days. So hopefully most of us aren't in the hospital that long, but on some occasions it can happen. Also, there's skilled nursing coinsurance, and I know this is something that folks want to pay attention to if you're particularly interested in learning about long-term care. So Part A covers your skilled nursing facility. We also call it a SNF as a shortcut, but this is covered again under Part A. So typically what happens is you have to be inpatient in the hospital for 3 days and then discharged to a skilled nursing facility. Now, that inpatient for 3 days is an important thing to pay attention to because if you're not in for 3 days, it may not be covered and be covered under this benefit. Or if you're in something called observation, that is something we're seeing a lot more hospitals do now. The observation coverage, if you're in the hospital, will not count for the coverage of being discharged to a skilled nursing facility. So again, if that's something that's going to happen because of a broken hip or other types of things, that's typically the most common thing we see. I know it happened in my own family with my mother-in-law. You do want to pay attention to that. So for skilled nursing facility, the first 20 days are covered, and then after that, there's a daily rate up to 100 days. So when you're looking at these costs, there are for original Medicare gap plans that can take care of these gaps that we're identifying, and Medicare Advantage deals with this a different way. Now, Part B, which is your outpatient insurance, I already talked about the 185 premium. For those higher income earning folks, that can be there can be a higher rate for that. Typically, for a couple, the standard level is $212,000 income, where if you're making under that as a couple, your Part B premium is 185 each. Because when you're on Medicare, everybody's an individual. There are no family or couple plans on Medicare. And then, if you're more than $212 a year, then you get something called the income related monthly adjustment amount, and you pay something that's higher. At Shine, we have charts that can share this information so you can figure that out if that applies to you. There's a Part B deductible that is a yearly deductible at 257, and that's pretty consistent with the supplemental plans. There is a supplement one that eliminates that Part D deductible, but that is only available to a certain population of folks. And then after that deductible, there's a 20% coinsurance for the Medicare allowed amount. So you may have heard that Medicare covers 80% and you have to pay the 20%. Again, a Medigap plan can assist with that, and Medicare Advantage deals with this differently. But it's 20% of the Medicare allowed amount. So say that the hospital charged $1,000 for an MRI, Medicare allows $500, you pay 20% of the $500. And then the final component of Medicare is the Part D drug plan. Those drug plans have a monthly premium anywhere from $12.40 to $190.80 a month. IRMA also applies to the Part D premium, so you want to pay attention there as well with some extra costs. And these drug plans, I think there's about 14 or 15 different drug plans. They have different formularies. Each drug plan classifies drugs differently for generics, tier 1, tier 2, tier 3, tier 4. Not all drug plans cover all drugs, so it's just something really to pay attention to. So some of the additional coverage we talked about was a Medigap plan, or also known as a supplement. That's something that you would purchase at a monthly premium. Medicare Advantage plans are that lumping together or bundling of plans A, B, and D, as well as some vision, hearing, and dental. Many of those plans don't have premiums, some do, but they have networks, HMOs and PPOs, where you need referrals, you might need prior authorization, you have to stay within a network, and they have a copay system. And then the prescription drug plans, that's something else you would purchase. If folks have been working for the state, for a county, municipal government, some other bigger companies offer retiree plans, and those plans are different than what we talk about in the marketplace. All of this is marketplace coverage. And typically those plans will be at lower rates or different types of options when they bundle things together. And if you are a retiree of a governmental organization, you should be talking to the Human Resources Department or the benefits managers there to find out about the different plans and what is offered and the costs. And then, of course, for veterans, there are VA benefits. And, sometimes our veterans don't get a Part D drug plan because they're getting their drugs through a pharmacy. At the VA, but they can choose to sign up for a Part D plan, and we've worked with many veterans who have done that as well. I've already talked a little bit about these Medigap plans. In Massachusetts, all of these plans do the same thing. Our Division of Insurance really, manages these plans pretty tightly. I think there's about 7 or 8 companies that offer these plans. And again, it's the bells and whistles that really vary from plan to plan. There are different costs for the different plans. But again, the major pieces that they offer, such as, covering well, let me go through the supplements first. So I'm going to start at the bottom, which is the core. So that pays, so as a beneficiary, you pay your Part A and B deductibles. So A is the hospital deductible of $1,676. B is the outpatient deductible, which is $257. but it picks up that 20% coinsurance and any hospital copays. So that can be helpful and really good for people who are relatively healthy, who don't go to the hospital, who just go to a primary care visit once a year. Supplement 1A offers you coverage of that Part A deductible. So typically, if folks are like, I just want to pay my premium and not worry about paying anything else or getting a bill from a hospital if I have to go inpatient, Supplement 1A is typically a plan that would give the most coverage for that. And really, the only bills you should be getting is for your Part B deductible every year, which this year is 257. Now, supplement one really doesn't have any out-of-pocket costs, but this supplement is only available to folks who turn 65 before 2020. And the costs are quite high for this. So, and actually, I think when we do the math, it's more expensive than just having the supplement 1A and paying that Part B deductible. Kathleen, anything else you want to add about this, or am I right about that in terms of the 1 and the 1A?
Yes, no, you're doing fine. It's great.
Okay, good, 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 good. Um, so, the other thing just to pay attention to here, is that with original Medicare and the supplement, you have flexibility to see any provider that takes Medicare. You don't need referrals, and you don't have to worry about networks, and that you do need to purchase a Part D drug plan. And this is a little bit small to see, but this is for anyone in Massachusetts that to look at the specific costs. It's all the stuff we talked about in kind of a charted format that might be a better visual for people to really understand. But this really goes over what the different options are. So the first column is really original Medicare and everything if you just have A and B and what the costs are. The next column is the core policy, and you'll see it picks up some of those inpatient hospital days after day 60 and that deductible. But there are still the costs for a skilled nursing facility, and there's still the Part B annual deductible, but it does pick up that co-insurance. And then the 1A, you see a lot more zeros, which is again, I think a little bit more comprehensive coverage, particularly if folks are worried about going into the hospital for surgery or if they have some kind of illness or issue that causes them to be hospitalized. And you still have that Part B deductible, and you'll see the coverage for supplement one. Now, the thing I didn't really talk about is that in Massachusetts, we have continuous enrollment for these supplemental plans, which means that you can you can sign up for a supplement at any point in time, and you can move between these supplemental plans from month to month. The insurance companies don't really like it, I don't think, but it is something that you can do. So say, for example, you are relatively healthy and you're like, well, there's about an $80 difference between the cheapest supplemental plan. So you sign up for the core. But, over the summer, you're on the pickleball court, you blow out your knee and you're going to need surgery. You don't know, it could be outpatient. You might have to go inpatient. You're not really sure, but it's August right now, the surgery scheduled for September. So you decide, you know what, I'm going to call my insurance company for the month of September and October. I'm going to bump up to the supplement 1A. I'm going to pay a little bit more each month, but I want to be covered while I'm, getting the surgery in case anything comes up. You pay a higher premium for September, October. Things are going really well. In October, you call up your insurance company and you say, I want to go back down for November to the core policy because I don't need to worry about that. So it's a way to utilize the supplements for the coverage that you might need and to help manage your budget. Anything else on this slide, Kathleen? Oh, you're muted.
I'm sorry, just to point out too, looking at the skilled nursing facility care, as you can see from core to 1A to 1, you can see if someone has core from days 21 through 100, they would be paying $209.50 a day, but then going into 1A, it would be $0, or if they had a supplement one, it would be $0. So, they would have that additional coverage till the 100 days, and then after the 100 days is, something that we'll discuss in upcoming slides.
Great, thanks. So the Medicare Part D prescription drug coverage, the number one thing I want to say about this is that this is something to be really tailored to folks based on the medications that you're taking. And we at Shine use Medicare.gov, which is a plan finder, and we'll talk about that a little bit more. But again, we mentioned earlier that everybody should sign up for prescription drug coverage, even if you're not taking medication, so that you avoid any penalties. And you want to sign, and those are the drugs that you would take at home that you would pick up at your local pharmacy. And that's usually covered under Part D. Other things that are injected or infused by someone else are usually covered under Part B, which is the outpatient part of Medicare. Now, you really, as we mentioned earlier, also want to sign up for everything kind of at the same time, so that you're not running into any of the late penalties or putting yourself at risk for that, because these late penalties, they can add up. So you really want to pay attention to that. And we again use Medicare.gov, and you can sign up for your own account. And we really recommend that and often do that with individuals because all your information is right there and it makes it really easy. And I find it to be a pretty user-friendly tool. So I won't go into this too much because it's a little complicated. It's not too bad, but there are different parts of the drug plan. The first is your monthly premium, which is a bill you pay every month to the drug company. The other is an annual deductible. Most all of the companies have an annual deductible, and in 2025, it's about $590. That means you pay your monthly premium every month, and the annual deductible you pay out of pocket up to that 590, and then after that the drug coverage really kicks in. And that's the initial drug coverage where there could be copays or coinsurance based on the tier. And that is up until what we now have is a $2,000 cap because of the Inflation Reduction Act that went into effect in 2025. And then once you reach that $2,000 cap, all your drugs are covered. The important thing to know is that that $2,000 cap applies to drugs that are covered on the plan formulary. So that's why we use the Medicare Plan Finder on Medicare.gov because it will show you if your drug is covered. If the drug is not covered, it is not subject to that $2,000 cap. So that's just something very important for you to know. A plan's formulary is a list of all the covered prescriptions, and those can change from year to year. So as I mentioned earlier, you don't want to put your plans on autopilot. You really want to be checking every fall what coverage you have. Around September 30th, every plan sends out what's called an annual notice of change or an ANOC. And that's something that will come to you in the mail. You want to open your mail. You want to take a look at that to make sure that your medication is on the plan formulary and covered and what the costs will be. That's something that we can help you with at Shine, or you can go into your Medicare.gov account and do it as well. You also want to pay attention to any quantity limits, prior authorization, or step therapy. All that is also listed on Medicare.gov. And different pharmacies have different costs. So you also want to take a look at the pharmacy. I have some folks that I've worked with where they pick up one medication at CVS, they pick up another medication at Walgreens or at the hospital. So sometimes you can even save some money by doing that. Um, and then it's important for folks to know that all Part D plans in Massachusetts that offer insulin on their formulary, it's a $35 max per month. And so the thing again to pay attention to is that if it's on the plan's formulary, so you really want to be checking that and making sure. Kathleen, anything to add here? Because this is always a tough thing to try to explain.
No, this looks good.
Good. Um, so this is another version of the chart we showed earlier, but now that you've got some more information, maybe this will make a little bit more sense and help you to think about Medicare. So basically, again, A and B are your foundation. A is your hospital insurance. B is your medical insurance. There are gaps in these in A and B, and those are co-pays, co-insurance, or deductibles. And so the way you fill in those gaps, you have two options. Option one is original Medicare, where you purchase a Medigap or a supplemental policy. Those are three types in the Commonwealth of Massachusetts. and you can decide which one you want. And then you also need to purchase a Part D drug plan. The other option is Medicare Advantage, which is also known as Part C. And those are bundled plans that combine A, B, and D, your drug prescription, as well as offering some vision, hearing, and dental. Now, if you choose Original Medicare, what happens with vision, hearing, and dental? Most of those supplemental plans will offer a rider on top of it. So you can buy a hearing rider, you can buy a vision rider. That's another way with those bells and whistles that those supplemental or Medigap plans differentiate each other from each other. So you want to check the plans and determine the plan or purchase a plan based on, what is going to be your need. If you wear glasses or if you want hearing, etc. And those needs certainly can change year to year. So those are the two basic options that we have. And I've already kind of talked about Medicare Advantage, but some of the things that we really want to highlight is that because everybody needs a drug plan, you want to make sure you're choosing a Medicare Advantage plan that offers you drug coverage. You want to pay attention to networks. When we're working with folks, we always say to people, you can check these networks online, but the number one thing you should be doing is going to all of your providers and asking if they take a certain plan. What happens is, people think, oh, well, if I go to a Blue Cross Blue Shield provider or a United Healthcare provider, I can see somebody in that network. That's not really how it works. These insurance networks or companies have their company network, and then they have a Medicare Advantage network within that company. So it gets a little bit smaller, and providers need to be a Medicare Advantage provider for a particular insurance company. So it's always good to go to your doctor, to go to your provider and ask them who they take for insurance. Um, and the thing also, I describe these plans as kind of pay as you go. So instead of a deductible, well, I think some may have deductibles, but a lot of them don't have deductibles. A lot of them are zero premium as well. But they have these out-of-pocket costs, which are copays. So again, some can be zero, some can be 20, some can be 45. And if you go out of network because you have out-of-network coverage, it could be as high as a 45% coinsurance. If you have an HMO and you don't get a referral or you go out of network, you could be on the hook for that bill. So you really want to pay attention to that. Medicare Advantage plans also handle hospitalizations differently, and they actually have a daily rate for the first 5 or 7 days. So they don't treat it like original Medicare, and you will have to have an out-of-pocket expense for a hospitalization in a Medicare Advantage plan. But what Medicare Advantage plans do is they have an out-of-pocket max. So that means that you're not going to pay any more than a certain amount. Typically for HMO or even the in-network plans, it's anywhere between $5,500 and $7,000 out-of-pocket max. And then for the out-of-network, the out-of-pocket max can be as high as $10,000. So what does an out-of-pocket max mean? It means that you have a really sick year and you're in the hospital a lot or you're going to a lot of appointments. The most you will pay is either 5,000 or 7,000 or 10,000, depending on the plan. And then after that, the insurance company picks it up, but that's still a lot of money. So again, you really want to be paying attention to, how much you go to the doctors, how much you utilize your insurance, and that can really inform your decision for what you choose. And again, this is just a comparison kind of side by side of some of the pros and cons or how these products work differently. So again, each can be very insurance. When I'm working with couples, one person could have a Medicare Advantage plan and the other could be on original Medicare. So it's very unique to the individual. It depends on what your medical needs are and what your budget is as well. So you really want to be thinking about these things. You really want to be looking at these things because your medical needs will change year to year. So some common missteps that we want to make sure folks are avoiding are missing deadlines, and then having to pay a premium, not reviewing your plans year to year, not making sure that your providers are in network, not making sure that your medication is on a planned formulary, you know, choosing what your spouse, a friend, or a family member has because they've had a really good experience, and that may be because it works really well for them, but it might not work for you. Going to out-of-network providers when you have a plan that requires you to be in network. And then the COBRA issue is something we really want people to be paying attention to. And that if you are over 65 and ending work or losing coverage, that you want to really kind of avoid those COBRA plans because you can run into trouble. And then, the income related monthly adjustment. Typically what happens is when you're signing up for Medicare, they will go back 2 years to determine what you're going to pay for your Part B premium. And if you've stopped work, your income is typically going to go down. So that's a life event that you want to alert Medicare to or Social Security to, so that you're not paying more than you need to. And there are programs that can assist. I don't know, Kathleen, at what point you want to take over here. I don't want to continue on and on. People may be tired of hearing my voice, but I'm wondering if you want to take over at this point, or I'm happy
Yeah.
to keep going.
I think I was just looking ahead and I think that there's a couple more slides before we get into the long-term care. Is that,
Okay. All right. Yeah. So I
do you
can
mind
keep going. Yeah. Yeah.
just until you get there and then I can
Yeah.
start from there? Okay.
Perfect. Perfect. Okay. So, if you're concerned about the cost of Medicare, there can be things that, or can be programs that can assist you. And we at Shine are actually really good at helping to screen folks and determine their eligibility for some of these programs that can reduce costs for folks. So, I want to talk about the Medicare Savings Program, which is a federal program. But here in Massachusetts, our legislature voted to make a change to the requirements for the Medicare Savings Program. So typically, when it comes to Medicaid or any other types of plans for folks who are of lower income, when you turn 65, they're looking not only at your income, but also at your assets. And usually, if you've been saving your entire, that's what you're supposed to do, is have a savings plan and have, an IRA or other resources to draw upon in your retirement. What the Massachusetts legislature did last year was determine that they would not look at your assets for these Medicare savings programs. So they're just looking at your income. So there are 3 different levels of Medicare savings programs for an individual. I think if your income is under like $2,996, and if your income as a couple is under $3,996, somewhere around there, you could be eligible for one of these plans now, or programs rather. These are not health insurance plans. These are cost assistance programs. So the QMB, which is what I call the higher level because it allows you to be eligible for the most benefits, it will pay your Part B premium and a Part A premium if you have one. It will also pay deductibles and copays. It will also give you an automatic enrollment and extra help drug coverage. So this is a real cost saver because right now the Part B premium is $185. It puts that back into your account or into your Social Security check. It also pays any of those deductibles or copays that we talked about with original Medicare, as well as I believe with Medicare Advantage. The extra help drug coverage, there are 3 0 premium plans, and then there are also plans that are reduced costs for premium, and this also reduces your drug costs, where it can be anywhere from $1 to $5 to $10, depending on the tier of your medication. The 2 other levels that you could qualify for are the SLMB, Specified Low Income Beneficiary, or QI1, Qualified Individual. And these levels allow you to have that Part B premium kind of come back to you, and it will pay the Part B premium, and it gives you extra help drug coverage as well. So again, we have more specifics around the different levels for income here, but it's around, again, that 2,900 as an individual, 3,900 kind of threshold as a couple. And so you really want to pay attention to that. It also gives you something called Health Safety Net, where services at an acute care hospital or community health center could also be covered at no cost to you. Prescription drug coverage, dental coverage may also be available at community health centers. Extra Help, as I mentioned, is a federal program, pays the Part D premium, deductibles, copays, etc., really brings down that cost. Prescription Advantage is another Massachusetts program for drug coverage, but basically what that is doing is it's really helping you get a special enrollment period one time a year. So if you are finding yourself in a situation where you get prescribed a very expensive medication, signing up for Prescription Advantage will open a special enrollment period where you may be able to change your drug plan one time a year. With extra help, it's important to note, new in 2025, I believe, as part of the Inflation Reduction Act, you can change your drug plan every month, which is a really great benefit for folks who have extra help. So you would apply for a Medicare savings program with an application. It's really easy. It's one page. You can also call Mass Health. I have done that with a number of individuals, and they will do it over the phone. So this, because it's determined by the state Medicaid program in Massachusetts, it is Mass Health. If you live in another state, you want to check your state Medicaid program, and they may have um, different criteria because again, in Massachusetts, they're just looking at your income. In other states, they may consider your assets. So this piece about the Medicare Savings Program and how you qualify and how you apply is very specific to Massachusetts. There is there are alternative options for individuals in case maybe a drug isn't coming up for you, being covered on a drug plan. This happened last week with somebody I was working with. There was no plan that was going to cover the particular medication, but when I ran it through GoodRx, it looked like he'd be able to get a coupon and it would be $23 a month for the medication. So these are different coupon type programs that could be a benefit to you. And it's separate from your Medicare Part D plan. And so you would just, some of them are apps on the phone or actual coupons that you have, and you would use it directly at the pharmacy. So if something is not covered by your drug plan, these are additional options for you. All right, so now I am done talking about Medicare and things related to that, and Kathleen is going to take it over and give the rest of the presentation.
So what is skilled nursing facility care? So skilled nursing facility care, or SNFs, are healthcare that's given when you need skilled nursing or skilled therapy to treat, manage, and observe your condition and evaluate your care. Nursing and therapy care that can only be safely and effectively performed by or under the supervision of professionals or technical personnel. Some of the components to skilled nursing facility care or going into a skilled nursing facility center is a semi-private room, a room that you share with other patients. You'll receive meals, skilled nursing care, physical therapy, occupational therapy, speech language pathology services, medical social services, medications, any medical supplies or equipment that you are using in the facility, ambulance transportation, and dietary counseling. So how does one qualify for skilled nursing facility care? So your doctor or other healthcare provider has decided that you need daily skilled care like fluids or medications or physical therapy, and you must get the care from or under the supervision of skilled nursing or therapy staff. You can get these skilled services in a Medicare certified skilled nursing facility, and you may need skilled services for one of the following: an ongoing condition that was also treated during your qualifying inpatient hospital stay, like Kristina referenced, the 3-day stay, even if that wasn't the reason that you were admitted to the hospital. Also, you may need skilled services if a new condition started while you were getting skilled nursing facility care for an ongoing condition. You may also qualify for skilled nursing facility care if you need skilled nursing care or therapy to improve or maintain your current condition or to prevent or delay it from getting worse. And like Kristina spoke about earlier, the qualifying inpatient hospital stay, this means that means a prior medically necessary inpatient hospital stay, not observation, of at least 3 days in a row, starting the day that you were admitted as an inpatient, but not including the day that you leave the hospital. Observation status or time in the emergency room before you're admitted does not count towards that 3-day qualifying inpatient hospital stay, even if you are there overnight. The skilled nursing facility 3-day waiver rule. Many Medicare Advantage plans waive that 3-day minimum. So that's important to know if you are someone who is in a Medicare Advantage plan. But if you are in like a Medigap, or if you are someone who has original Medicare, you would still have that 3-day skilled nursing facility inpatient hospital stay rule. Also, you can always contact your plan for more information. Next, I'm going to talk about Medicare and the home health services. So home health services qualifications. So a healthcare provider, like a nurse practitioner, must assess you face-to-face before certifying that you do need those home health services. They must order your care, and a Medicare certified home health agency must provide it. So there are very strict rules about qualifying and also who is going to be providing those services. Medicare Part A, the hospital insurance, and Medicare Part B, the medical insurance, will cover eligible home health care services as long as you need part-time or intermittent skilled services and you're homebound. Medicare has specific rules about what homebound means, and that means that you have trouble leaving your home without help, like using a cane, a wheelchair, walker, or crutches, special transportation, or help from another person because of an illness or injury. Also, leaving your home isn't recommended because of your condition, or you're normally unable to leave your home because it requires a major effort. Home health services cover part-time or intermittent skilled nursing care and home health aid services, and this is for up to 8 hours a day combined for a maximum of 28 hours per week. So it's important to know that unfortunately Medicare does not cover 24-hour care in the home. So home health care services, it's up to 8 hours a day combined for the maximum 28 hours per week. You may be able to get more frequent care for a short time. Maybe it's less than 8 hours each day, but no more than 35 hours each week if your provider does determine that it is necessary. Medically necessary part-time or intermittent skilled nursing care. Some things that would be considered that would be wound care for pressure sores or a surgical wound, patient and caregiver education, intravenous or nutrition therapy, injections, monitoring serious illness and unstable health status, any therapies like physical, occupational, and speech language pathology services, medical social services, injectable osteoporosis drugs for women who meet certain criteria, durable medical equipment, and then medical supplies for use at someone's home. Continuing on about home health care services, so part-time or intermittent home health aid care only if you're also getting skilled nursing care, such as physical therapy, speech language pathology services, or occupational therapy at the same time, would include help with walking, bathing or grooming, changing bed linens, and feeding. Medicare does not pay for 24-hour day care at your home. It does not pay for home meal delivery. It does not pay for homemaker services like shopping and cleaning that's unrelated to your care plan. And Medicare does not pay custodial or personal care that helps you with daily living activities like bathing, dressing, or using the bathroom when this is the only care that you need. What type of caregiver will Medicare pay for? So Medicare caregivers are qualified healthcare professionals such as nurses or therapists. Medicare does not pay for care for family members, friends, or privately hired home health aides. Mass Health has a program here in Massachusetts, the Mass Health Personal Care Attendant Program, and this would benefit older adults who are permanently or chronically disabled and require help with daily living activities, including dressing, bathing, and meal preparation. The Mass Health Personal Care Attendant Program is a participant-driven program that requires the recipient to act as the employer and handle hiring, training, and firing of their caregivers. The personal care attendant program funds up to about 50 hours of care per week at a fixed hourly rate, which is assessed annually. One thing to note about the personal care attendant program is the individual can't hire their spouse to be their caregiver, but can hire adult children or grandchildren. There is no enrollment cap, so everyone who meets the program qualifications is guaranteed services in this program. Medicare and long-term care. Medicare and most health insurance, including Medicare supplement insurance or Medigap's, do not pay for long-term care. So what is long-term care? Long-term care includes medical and non-medical care for people who have chronic illness or disability. Long-term care helps with basic personal tasks of everyday life, sometimes called activities of daily living. Some of those include personal care assistance like dressing, bathing, and using the bathroom, home-delivered meals, and adult day health care. You might qualify for long-term care through Medicaid or here in Massachusetts, Mass Health, or you can choose to buy a private long-term care insurance. Long-term care in Mass Health. So Mass Health is the Medicaid program here in Massachusetts. So long-term care Mass Health pays, for stays at a skilled nursing facility or nursing home beyond 100 days. So as we know with original Medicare, long-term care or stays that are over 100 days are not covered under Medicare. Long-term care Mass Health provides Mass Health standard benefits. Here in Massachusetts, the long-term care Mass Health program has an asset limit of $2,000 for the applicant, and the spouse or the person that's living in the community can have up to $157,920, and this number is for 2025. And then excess assets can be transferred to the spouse. Somebody who is interested in applying for this program would need to complete a SACA form here in Massachusetts and are required to fill out the sections of the long-term care supplement, even if they are someone who is under age 65 years old. If you are interested in learning about long-term care programs and with the Medicaid programs in your state, please contact your Medicaid office or SHIP program in your state. The frail elder waiver, I'm going to speak particularly about the Massachusetts program, provides Mass Health standard benefits and in-home services to allow a beneficiary to remain at home. The individual must be age 60 years or older. If they are age 60 through 64, they must have a disability determination. A beneficiary must meet Mass Health clinical eligibility requirements for nursing home care, and this is done through the ASAP or the Aging Service Access Point. And for the frail elder waiver, there is a monthly income and asset limit for the program. So it's $2,901 for the applicant in 2025. There is no income limit for the spouse. And then the asset limit for the applicant is $2,000 and $157,920 for the spouse. And again, this is for 2025. Excess assets can be transferred to the spouse. Somebody who is interested in the frail elder waiver program would need to complete the SACA form and the required sections of the long-term care supplement, again, even if they are under the age of 65 years old. If you are wondering if your state has a frail elder waiver program, please contact your Medicaid office. So on this slide, we have some resources in regards to long-term care. So on the left-hand side, we have some scenarios of if you're looking to plan for long-term care. And on the right side, we have some places where you can check out some more information in regards to that. So if you need help for planning long-term care, on the right-hand side, you can visit the Administration for Community Living for long-term care information and planning resources. Also, information about long-term care insurance. You may want to contact your state insurance department or call 1-800-MEDICARE. To find out if you qualify for long-term care coverage through Medicaid, you're going to want to contact your state medical assistance or Medicaid office. There's also a shopper's guide to long-term care insurance. We have the website, the National Association of Insurance Commissioners, or here in Massachusetts on mass.gov, there is a What is Long-Term Care Insurance? To find out more about home and community-based services, we have some websites here as well, but also you can contact your Medicaid office to find out more regarding which programs are available to you in your state. For information about subsidized senior housing, you can explore state and federal programs that may help for housing for some seniors with low to moderate incomes. Also, information on continuing care retirement communities, communities that offer different levels of housing and care. You can contact your area aging Agency on Aging. And also we have another website here about nursing home quality inspections. To find group living arrangements, there's an elder care locator website we provided here as well. And then lastly, there is information on the PACE program. The PACE program is the program for all-inclusive care for the elderly. And this is a Medicare, Medicaid program that helps people meet healthcare needs in the community instead of going to a nursing home or other facility. My Ombudsman assists with individuals to address concerns or conflicts that may interfere with the enrollment in a Mass Health Managed Care Plan, including OneCare, SCO, and PACE. SCO is the Senior Care Options. I know we haven't spoken about that just quite yet, but those are some programs that my Ombudsman can assist with. They also work with Mass Health and the plans to help members resolve concerns and ensure access to benefits and services. And so here in Massachusetts, we have provided the contact information for my Ombudsman. Mass Options. Mass Options is the website run by the Executive Office of Aging and Independence. It connects older adults, individuals with disabilities, and their caregivers with agencies and organizations that best meet their needs. And so here are just a few of the resources that you can find more information out on. Housing, food, caregiver supports, health and wellness, day services, insurance, transportation, and in-home support. So we have the phone number that's provided here, as well as Mass Options does have a website. Just a little slide to show where some other locations of places you may need to contact. The Social Security office, so we have the phone number and the website. There's also a website to find your Social Security Administration office near you. We have Medicare, 1-800-Medicare, and the website that also has the Medicare Plan Finder on it. And then we have here in Massachusetts, the Massachusetts College of Pharmacy and Health Sciences Pharmacy Outreach Program. So they're a great resource. Some of them are Shine counselors there at their office as well, and they can work with consumers of any age here in Massachusetts. Maybe they need to review their medication lists and talk about different medications and how they interact with one another, but they can have a great meeting with somebody from the Pharmacy Outreach Program. Then lastly, we have the Shine program. So the 1-800 number, that is the Mass Options number. So if you're not sure here in Massachusetts where a local Shine counselor is near you, again, our program has 14 regional offices across the state, and they oversee the towns that are in their region. So we can find a Shine counselor that's closest to you. We also have the shinema.org website, and also mass.gov has information on the Shine program as well. Thank you. And to be connected to a local Shine counselor and schedule an appointment, you can call Mass Options or email the Shine email box.